the pieces that I've learned as I've had the opportunity to work with so many of you across the country, and as well as the lessons learned in Columbus. So why don't we go with somebody's flipping these, right? Go, Jason. Next one. There we go. So one of the observations, just to start off, is that when I look across the country, there are lots of communities where this is the current state on a realistic basis. There's a bunch of really great programs, and those are reflected in the yellow and the red. And there's programs that do prevention, there's programs that do shelter, there's drop-in centers, there's treatment, there's supportive services, and there's supportive housing. And those programs really operate fairly independently. They're fairly well networked now, much more so than they probably used to be, but they really think of themselves in those independent programs. And then there's this body of people that are in that big green silo there, which are those people who are at risk of homelessness. And as they're at risk of homelessness, they're on the brink of homelessness, those individuals, whether they're families or youth or they're single adults, they're kind of daunted by how do they get into any one of these programs, and it really is more or less wherever that availability happens, in many, many places. That's kind of what the experience is. Now, it may not be that when you describe this in your continuum of care exhibit 1, this is not the picture you would describe, but this is probably, this is often what that picture is that, and that will be how it feels often to families or youth or individuals accessing it. So when we think about kind of what is the more idealized picture, we go to the next slide. And the more idealized is that the desired state is that we're responding to individual and family needs to get them what they need at the right time, at the right amount, and the right intervention. And so when you think about, and this is different than a continuum of care focus, but you think about that there's families who have a housing crisis, or individuals or youth, and there's multiple points of entry. They're entering the crisis because of an eviction, they've been released from institutional care, they've had some sort of a personal or family crisis. The eviction may be that they were staying with family or friends, or it might be a formal legal eviction. But nonetheless, it's a family that's in crisis. And ideally what we'd like to see is that there is a rapid response system in place that gets them to stable housing, and that's the green. So we want to see that if there's a crisis, you end up in the green box as quickly as possible, and that is targeted to their individual needs. And there's lots of endpoints of it. It could be that it's affordable housing. It might be that it's reunification with family. As mentioned this morning, with youth in particular, this can make a lot of sense. It might be, though, that they need a deeper subsidy of permanent supportive housing. So when you think about it, the movement is you want to take a family that's in the red box and get them as quickly to the green box, and the middle box is how you get there. And that rapid response system, as we think about it, is one that's able to assess and develop a rehousing plan. And this doesn't matter whether you're a prevention program, or you're an emergency shelter, or you're a transitional program, or you're a treatment center. Any one of those things should be able to be a part of a community response that has a rehousing plan that is core to it. Because the reason people are homeless is they have no housing, so the primary outcome has to be focused around rapidly rehousing them. So those activities could be things we call prevention and diversion, is helping the family avoid homelessness and not have to enter in the shelter. Those are prevention and diversion activities. It could be that they're already homeless and on the street, and it's the street outreach activity. But that street outreach activity also ought to be about assessing and developing a rehousing plan, so that the focus is heavily on that. It can be, as I said, it's an emergency shelter or a transitional housing program, but that's got to be the core piece to it. And again, with that, it's as short of stay as is possible to connect them to housing. It's not intended to be a system that fixes people. It's intended to be a system that gets people as quickly to stable housing as possible. And that's where rapid rehousing has come into play. It's the new tool in the toolbox that's been developed over the last 5 to 10 years on a national basis, most recently deployed rapidly, or recently through the HPRP Recovery Act work. So when you think about creating a community response, this is what we're talking about, is you're going from those separate programs to something that is aligned and works well. How that looks in communities will vary quite a bit. So next slide. So from the Alliance's perspective, they have, and we certainly agree to this, that it's important that there are places to access services. There's an ability to assess the family's strengths and desires. You don't just want to assess the barriers, you also want to think about what assets they bring and what do they want to get out of this, because they are your partner in this work. You want to look at how you can have linkage and even better have integration with mainstream services and community supports. When I think about mainstream services, to me, those are programs like the TANF programs, the workforce investment programs, social security programs. Community supports are those things that are available in the community. It might be the church's food pantry. It could be community supports are available from their family or friends. But some of those things that are kind of the non-governmental, but in a family's life are absolutely critical to helping them have stability. You also want to think about right-sizing the system. You want to have just the right amount of resources to rapidly respond to families. What this means is it's somewhat of a dynamic approach in the community, which is hard for us to think about if we only think about responses in those fixed boxes. So it's not about, it's about the ability to get the right response at the right time. And so you've got to have a dynamic approach to this. And then the last is the importance of these connections to prevention, to rapid rehousing, affordable housing, and permanent supportive housing. So knowing where those resources are going to be in your community and how you can access them and get the right person to the right response at the right time. So when you think about your system, we want you to think about these different response possibilities to it. So what I'm going to go through here is I don't think any one community has it right as I've traveled across the country, and I don't think that any one community response can be overlaid into another community. What you're going to be doing is, if you are a system planner in your community, is you're going to look out and you're going to pick and choose from different places, disparate aspects of what things have worked, and apply them in your community, and it's going to be very different depending on the jurisdictional approaches you have. So some of you have a joint city-county government, some of you have a county that delivers the workforce investment services, but the social services come from the state, and there are no nonprofits doing community mental health, so you're going to do mental health. So it's really going to vary by community, but so I'm just going to try to point out to a few things that we have seen as noteworthy across the country that you might want to do. But there's hundreds of examples of parts of the system that are working well in different pieces. So you want to, that's one thing you want to think about is what are the pieces of it. Coming from Columbus, I can say one of the things that we were able to develop is a single point of access that has a priority around diversion first and shelter admission second. And that meant that no family was left on the street, but there was a heavy pressure put on trying to divert families to community resources so they didn't come to shelter. Columbus also had an approach about right-sizing the systems. Essentially, over time, using data, it was decided that we moved from all shelter and transitional housing, so that everything was its own independent programs, to a mix of shelter, rapid rehousing, some transition in place models where some conversion happened, and then permanent supportive housing. So a really intentional approach to changing the mix of responses available in the community. And the third piece is that there was a lot of work done around coming up with assessment tools. Assessment tools are only as good as the staff that administer them, but what we discovered in Columbus is even when we had a systems approach, each point of it had its own assessment. And when we did Lean Six Sigma processes, which is process improvement, what we found is we were subjecting the families to hours and hours of assessment just within the homeless system, all for the same purpose. And so it was an intentional work between the sheltering providers, the rapid rehousing providers, the prevention providers, to come together and say, how do we have a unified application that gets the right amount of assessment at the right time and dramatically reduce the amount of time in the assessment phase. That was important because it then freed up all of those case managers to work on things related to placing folks in housing as opposed to just doing assessments. So really recommend looking at some Lean Six Sigma approaches. Fresno is just an amazing community that's here in California. And what's really exciting about Fresno is their housing authority is the lead entity and a key partner in the continuum of care. I call this out because they provide those connections to affordable housing through their traditional programs, but they also have really stepped into the space in helping figure out how to do rapid rehousing and prevention. So many communities haven't thought about the breadth of experience that a public housing agency can bring to it. Fresno is just an amazing example of what a housing authority can do as part of your systematic approach. New York City has obviously lots of bandwidth, but just want to call your attention to a few things that they're doing that are worth looking at, and also to put together some contrasts here. In New York City, they do have a freestanding intake center that's called the Path, and it does some prevention and diversion activities, but they also do community-based prevention through a network of programs that are called home base. The reason we wanted to just rank this too is if you're doing a central point of access, you have to think about whether it's really intended to be an intake to your sheltering system, or is it intended to be a prevention and diversion point? And is it intended to be providing those prevention services? You can separate the functions, and in some cases that makes sense for you. In other communities, it makes sense to roll these all up into a single place. In some places, it makes sense if this is all kind of virtual. And so if you look at the New York model, you can get some sense of kind of how robust you could be. They have a really extensive intake process because it is a right to shelter, and they're establishing eligibility for what is a safety net entitlement in New York City. Mainstream and supportive services are, they've developed a new centralized case management that allows providers to see where the family has access to other mainstream served agencies. And this is just in the process of being rolled out, and it's being used by the city staff themselves. But that ability to see the mainstream supports access is really, can be helpful. And so even in a smaller community, you can think about what are the partnerships you could have with your public welfare system to understand the extent families are receiving food stamps or TANF or any of the health insurance programs. How could that be integrated into your work? And then the third piece is just to point out with New York City, and not saying they've achieved the right sizing of the system, but they just invest a lot of effort in understanding what works, using research, using data, and understanding what's effective for the different subpopulations within it. So it's hard to imagine how you replicate New York, but there are some things there that might be worth looking at. Salt Lake City is a much smaller community, and they are just phenomenal in the way they've brought mainstream services and supports actually directly into partnership within the homeless service system. They are just phenomenal in their work on workforce services, with TANF, with employment services in ways we haven't seen other communities be able to get that to the table. They also did a major system redesign and went from providing primarily shelter and transitional housing, and they redesigned with HBRP to increase their rapid rehousing over shelter as a priority, and do a housing first model with their family program. And so it's really worth looking at what they're doing in that way. They also have been working a lot on their connections to housing, the landlord negotiator to try to access affordable housing, and then they have these really, like Fresno, they've got some great public housing agencies involved, and there are other partners in it. This landlord negotiator or broker, or there's all different housing locator, those seem to be important things that you want to think about, is how you're going to get access to that housing that's out there. And it's not just the subsidized housing, it's the affordable, it's the housing that's provided on the private market that's kind of below market, and those property owners that you could work with to take your family. So getting those connections is really important. Seattle has been working to design a uniform assessment for families through a grant for the Gates Foundation. They have a very large network of family providers. We're really excited to see how that assessment tool comes out, because they're providing a lot of thoughtfulness to that approach. They also have really tackled this issue of mainstream services and supports, and are bringing as many players to the table. Betsy Lieberman, who was honored at lunch, she's with Building Changes. They provided tremendous leadership in this area. They have coordinated access to benefits, and then they also have a Navigator pilot project that works with their workforce investment. So I think is that the last one of the examples? So we just showed these to you is you got to think about the different points within your system that you want to bring on and to be part of the system, and then go find those best practices, bring them locally, and replicate them in a way that makes sense in your community. So again, these are, as we said earlier, from an alliance perspective and from a USICH perspective, all of those things you need to think about as you develop your rapid response system of care. and you really need to figure out all of these things. You can do some things better than others, but you really want to figure out something on all of those to get to a systematic approach. So one of the observations, just to say, as I've traveled the country and talked with many of you, is systems are fine, and it's important to design them. But what are the things that seem to be making the real difference in communities in changing the results for families? So, you know, if you've got a community and you don't have, your families are in the scattered approach and you don't kind of know what their outcomes are, when you've moved to a more systematic approach, what are the things that made a difference? And so some of the research has shown, but as well as the conversations that I've had, our folks say that there is a commitment that the systems has housing as a goal. And that the purpose of the homeless system has to be that housing is the goal. And when that is very clearly embedded in it, you get much better results because the alignment happened. The second piece is that there's a system that is the focus and the intent, that is not intended to be a network of provider programs, but that you've decided this really is going to be a system which has a beginning to it and an end to it, and you've got things organized around it. So you have to be committed that this is going to be a system, not just simply a network. The other piece is that the system only works if you have trained staff and a plan to deal with staff turnover. So the systems only work as well as the people within them, and oftentimes we design systems, but we forget about the fact that the staff really have to have training in this, and that there will be turnover. And I just want to emphasize this is because you have a lot of professionally trained staff who are social workers and they've got other degrees, but they're typically not trained in the social work programs about how you get people to housing. And what are the skills that you need to do that? And having, it's not just a case management approach, it's very housing focused. And so you need a system-wide way to think about that you have trained staff, because if they deliver crappy services, your system isn't going to work. If your system works because there's one miraculous supervisor who supervises the central point of access and she gets a promotion, all that knowledge walks out the door. So plan around that because you're going to have staff turnover. I have seen systems completely shut down simply because a few key people left and there was no residual left behind. So think about that. A fourth piece is to think about those collaborative agreements. Those can be both formal and informal. If you're running a prevention and diversion program, you have to have somewhere to send your people to. And if you haven't established those relationships, they're not going to be able to accept the family who you're trying to refer to them to provide that. So you've got to do a lot of work about thinking about what are the relationships that you need to develop so that when you do that prevention and diversion, there's somebody on the other side. You need to have the collaborative agreements between the programs that are within the system. They can be informal, they can also be formalized. It's really going to be about what's the culture of your community. Some communities, if it's not in an MOU, it's never going to work. Other communities are just horrified that you never write anything down. So you got to figure out your own community, but everyone has to understand what their role is in the system, what their commitments are, and be able to make that work together. The final piece on this one, before I get to the next slide, is the importance of having funding be aligned so that you don't have funders that are asking for an outcome other than housing. That's that contradiction to it, and that there's some alignment. It makes it possible for providers to be successful in it. We also know that families need some level of flexible assistance, so you've got to find that flexible funder in your community. Often that can be the private sector who doesn't have as much government rules. Sometimes it can be the government sector. But make sure you've thought about, you want the resources to be aligned in a way that gets kind of results. And if you don't think about those funding alignments, what happens is you're back to the independent programs because they're a competition in order to meet competing priorities from their funders. Another observation is it's really important to do data analysis for daily system and program management as well as performance. And every community should have an operational HMIS. Many communities have an operational HMIS for purposes of submitting data to HUD. And that is the end of it. And that won't get you where you need to go. Where you really need to be able to do is to use that data in a way that you can tell what's happening on a daily basis within your system, that if you're a program within it, you know what the results are from you, from your partners, and you can use this to make the system work, but you can also use it for the performance. And that if you use it for performance, you can use it to direct the money to higher performing programs, programs that take clients that are harder, that need deeper studies. If you don't have that data and the analytics to do it, you can't really use it. So it's not enough to just have a functional HMIS. You have to be able to analyze and use that data. Transparency is incredibly important. By transparency, I mean that everyone knows what the system outcomes that you're driving toward, everyone knows how the system is doing toward those outcomes, and everyone knows how every program within that system is performing against those. And that ability to publish that data transparently, that it could live at a continuum of care website, at a funder's website, that it's shared amongst the providers, that transparency is just incredibly powerful to get better results. At every level, you need to simplify and streamline your efforts. I think I can make the most complicated systems because I just add one more and one more and one more, and pretty soon, you know, it's 150 steps. And what you have to do is go back to an okay and say, well, what is the minimum number of steps that we need to do? How could we make this simpler? How do we make this work for shelter staff who may just have high school degrees and they've got to have tools that will work with them. In the midst of trying to pass out the soap, they also be able to need to use that. So really think about all the ways you could make the system work more simply and on a more streamlined basis. It also is really, really important to nurture that network of housing options. And whether you do that with landlord negotiators or teams, or you do, you know, celebrations of, you know, property management companies that give you units. I mean, think about it. You've got to have an array of housing options, and it's your obligation as a system to make sure those housing options are there. You can't be a housing-focused system if you don't have those options. So really got to work on that. And then I think the final piece is just to say this may be self-evident, but a lot of systems fail because there hasn't been clear communications. Folks are not talking to each other about the successes, and they're not talking about the problems. In some communities, they only talk about the problems, and oh my gosh, there are so many problems. And if you are a community that only talks about problems, it's going to be hard to work in that. But if you're a community, there are all these other communities, and all they talk about are the successes, and nobody actually mentions the fact that things are working. That is equally detrimental. So think about how you are communicating both successes as well as the challenges and how you solve them together. And do this in, as open and a transparent and candid way as you can. We're all in this for the same purpose, which is to make sure families have a safe, stable place to live so they can get on with their lives. And so if you don't have that level of communications to make that possible, I've seen that it's really kind of funny, like in some communities, if they're not communicating well, they just get one more solution that isn't a solution. And so really think about how you can both praise and be critical in critiquing in ways that get to better pieces to it. All right, turn this over to Kathy. She's going to tell you how it really gets done.
Okay, so first of all, everybody stand up. Raise your arms really high in the air and turn around in a circle. Oh. Very good. Oh. And break the microphone.
Only because this happened to me earlier.
Oh,
you got it?
Yes.
Okay.
Well, hello everyone. I'm Poppe Cathy. I direct the Office to End Homelessness in Minneapolis and Hennepin County. So I'm very happy to be here. What I thought I would do, first of all, I just want to start by saying how much I completely agree with Barbara about the notion that no one community has the answer to this. So I think I'm here just to show an example of something that we have done over the course of many years around families, and of course, depending on your community, to pick and choose what pieces might make sense for you. So I'm going to show one example of what we have been doing around sort of systems work related to families, and then I'm going to talk about what we're doing that's a brand new systems work around youth, so that you can see sort of the well-developed system and then the one that's really just beginning, and that's, you know, certainly an area where we could all have dialogue as well. And I think I'll just do those two things and then turn it over to Heather, and she can lead us in a conversation about this work. So, in Hennepin County, we have a right to shelter policy for families. So, and I know that not everybody has that, so that changes the game right there in terms of, you know, how communities are so different. But we do have a right to shelter policy, which means that we're required to shelter every family that in Hennepin County that comes to our doors. So we automatically start off having a pretty major incentive for prevention and for diversion from shelter, because of course, as you can imagine, that would be a large number. Many years ago, probably in the mid-'80s or so, very early '90s, we really had a major crisis because we had so many families coming to shelter. We had a right to shelter policy. Our shelters got full. We ended up just having relationships with hotel, motel owners all over the county to place families and pay for them in hotels. It was really pretty much a disaster. So at that time, we said we needed to come up with a much different response and a much different system response to these families. So, first of all, what I think I'll talk about is prevention. So for years and years, we've been doing prevention. We have a state program called the Family Homeless Prevention Assistance Program that provides us resources for prevention, and then HBRP came along, obviously, many years later. And so we've been providing prevention to families for many years and thinking very highly of ourselves because, we're preventing all these families from entering shelter. And I think our statistics were, on average, 98% of the families we give prevention money to don't ever show up in our shelter system. So we're doing a great job. Well, just a couple of years ago, actually right before the HPRP money came out, we decided to do a very serious evaluation of our prevention program. So we looked at all the families that were in our shelter system, and we just looked at all the data on them. What was their income, what were their ages, what were their barriers, etc. We did the same thing with all the families that had received prevention assistance, and with the hope that these families, of course, would look very, very similar. Because if they looked similar, that would mean that we were targeting well and preventing homelessness. Well, what we found is that they didn't look at all similar. The families that were receiving our prevention assistance had much higher incomes. They had much fewer barriers. I think about 2 or 3% of those families were young moms, mostly young single moms with young children, whereas 33% of our shelter population is young moms under 25 with small children. So we were totally off the mark, to be honest. And so this is one of those times of being very humbled by something and saying, okay, we have to really rethink what we're doing. So we redid our targeting, or we started targeting our prevention assistance based on that information. So now we only target prevention to families that meet the threshold of 30% or lower of area median income, so very, very low income families. We're targeting more to young moms, etc. So that's what we've started to do, and we expected, to see, we had to really readjust what we thought of as success. So we might not have a 98% success rate anymore, of course, because we're now actually targeting money at people who are more likely to become homeless. But frankly, at least in the short-term evaluation of doing this work, it's still around 90% don't return to shelter in a year. So even targeting deeper and focusing those resources at families that are more low-income and have bigger barriers, we haven't seen a huge number of families showing up in shelter. The second piece, so after prevention, of course, then is diversion. So when a family shows up at the Hennepin County shelter team, we do have a single point of entry for families. They do everything they can to divert them from shelter. So where did you stay last night? Can we call the place you stayed last night? Can we convince them that you should be able to continue to stay there? I mean, a really pretty active diversion to prevent people from entering shelter. Once they do enter shelter, every single family goes through an intake process where we find out, what do they want, what do they need, what are their, what are they most concerned about in terms of their children in school or whatever it is. So we make sure that those resources are available. And then within 2 to 7 days, we do something that we have a rapid exit screener. So we call rapid exit what many people call rapid rehousing. So same thing, so if you'll hear me say both. The rapid exit screener sits down with every family and goes through a list of information, basically trying to understand what their barriers to housing are. And then assigns a level of barrier to those families. So barrier level number 1, families have minimal barriers. They ended up homeless, it's certainly income-based, but they don't have unlawful detainers. They've had rental housing before. It seems likely they could get it again. We will, of course, support them and help them maybe with application fees or whatever they need, but it's a pretty short-term assistance, and they don't get referred to our rapid rehousing program. Level 2 barriers, maybe they don't have rental history, but other than that, it's not like they've got a lot of barriers on their record. Still, most likely not to get rapid rehousing assistance, but we certainly will point them in the right direction, provide support. Then level 3s and level 4s, we're starting to get into the families that we're really trying to target these resources to. Level 3s are families that have, maybe some criminal history, maybe they've got a teenage male in their family, which in our community makes it really difficult to get housing. A variety of other things that make just barriers that will prevent them from getting into housing. Level 4 are families that have been homeless a very long time, long-term chronically homeless families. And then level 5 are families that have multiple barriers, mental health issues, chemical dependencies, a wide variety of things which frankly probably isn't the best target for rapid rehousing, at least without the support services that they need. So we will target them to programs that do have more intensive case management and supportive services, often permanent supportive housing. So that's how we really try to target what's pretty limited in our community in terms of permanent supportive housing resources at those families that really need that level of support. So then they'll go through the rapid exit process, and then they'll work with community providers who will work with landlords and get them into housing and provide those services. So the average length of stay in our county shelter is for a family is 38 days. So it's a pretty intensive process with those families over that 38-day period. But once again, we were saying, okay, so rapid exit or rapid rehousing has been pretty successful. We see about probably about 90% of the families don't return to shelter within a year, so that seems relatively good. But once again, we wanted to evaluate what's the deal with those 10% that are. So we worked with the University of Minnesota. They studied the data that we had on the families returning. They also looked out more than 1 year. And if we actually looked out 3 years, our success rate went down a little bit. Only about 20% of the families did return to shelter. So 10% after 1 year, 20% after 3 years. So we still want to figure out what's going on there.